Okay, we now are at half capacity. We have some time constraints, so we are going to move forward, and I will share with you now the agenda. So we had this small onboarding right now. And then we'll ask Birgit to give us a little bit of an opening statement to this talk. We will then have our colleague from ITU, Simona, to have an introduction of the project and the work package 5, which is the one related to the policy. I will then share with you a small presentation that aims to share with you how we are contributing to an European health policy framework. Then we will have our esteemed Carme Pratdepàdua from the Catalan Department of Health that will share with us the mConnecta platform. Then we will have Mariana Meira from the shared services of the Ministry of Health of Portugal to share some experience of mHealth integration in health systems. And afterwards, we will have also Erik Vertommen, which is a project manager in mHealth and the Belgian Federal Public Service, that will also talk about the organization of governments of mHealth in Belgium. And then we will have a small discussion. Okay. So we already have some more people here. That's very good. Hello, Birgit. I hope you're doing well. I would like, in the name of the mHealth Hub project and myself, to welcome you and to thank you for being here. And I will invite you to say a few words, if you don't mind, for us.
Okay, thank you, Samuel. Good morning, everybody. On behalf of the European Commission, I would also like to welcome all of you in this third mHealth Hub talk. This is one of the objectives of the mHealth Hub project is to share information, exchange knowledge, and learn from each other. And therefore, this series of talks is very important to see how some forerunner countries are dealing with integrating mHealth solutions in their national health policies. And that's why I'm delighted that we have a very nice lineup of countries that have experience and can share best practices with us today. But even maybe more important is also to share with us where things didn't work and where you faced some obstacles, some failures, some paths, routes that you took that were not so successful, because that will help countries that are starting to deploy their mHealth policy to not make the same errors. So I'm very much looking forward to the presentations and the discussions today, and I hope you will enjoy it. Thanks a lot, and over to you, Samuel.
Thank you, Birgit. Thank you so much. Indeed, I hope everyone here enjoys, and we hope to contribute a little bit more to this issue. I will now like to give the floor to Simona to talk us a little bit about the project for anyone that doesn't is quite familiar with it. Simona, over to you.
Good morning, and thank you, Samuel. Thank you, Birgit. So we provide just a brief overview of the project and on the work package 5. So the European mHealth Knowledge and Innovation Hub is a project to share national experiences on mobile health and to help countries and regions introducing mHealth programs, as Birgit a little bit alluded to. The project is funded by the European Commission under Horizon 2020 program, and it's a joint collaboration between ITU, WHO, European Commission, and the Ministry of Health of Andalusia, Spain. The implementer of the hub was selected by the ITU and WHO and represents a consortium of 18 private and public institutions from across Europe, led by the Andalusia Public Health System. The hub was launched in February 2020 in Geneva, and our main dissemination platform is the website that you can access at the link on the top of the slide. Next slide, please. Okay. The hub will produce a set of integrated toolkits or knowledge tools to support and guide the countries in the adoption and implementation of mobile health programs. The first knowledge tool is on the assessment of mobile applications, where we analyzed the existing assessment frameworks and identified most relevant criteria to assess the quality, the reliability, usability, effectiveness of the apps, but also potential common elements of mutual recognition between these assessment frameworks. Then we provide recommendations and guidance to countries for the adoption of these assessment frameworks. The second knowledge tool, it's about an intervention-specific program based on assessment of country needs, and due to its relevance in Europe, we chose to tackle diabetes and provide framework and roadmaps to include diabetes programs in national health systems. For this, we adopt a user-centric, a modular approach depending on the maturity level of the country. The third knowledge tool is on the integration of mHealth in national health systems, and we look at all these topics and cross-cutting areas and concerns that need to be handled at system level, like data governance, change management procedures, accreditation processes, data sharing, integration with eHealth records, privacy and security. And this is intended to be a generic tool in nature that could be picked up by countries and adapt to their own context, depending on their needs and maturity level of the technology in the country. Another very important product at policy level will provide contributions towards a common European policy framework that will support innovation and facilitate cross-border sharing and adoption of innovations. Central to the hub is the service portfolio that will wrap up the above mentioned knowledge tools into tangible products for the countries and will provide additional access to resources like expertise, matchmaking, repositories, so on and so forth. Last but not least, we look at, of course, at ethics issues for the project and around the adoption and uptake of mHealth in general. Next slide, please. Okay. The hub work related to policies in mHealth is included in Work Package 5, and there is a particular deliverable D5.1 for the development of this policy framework. We identified here a few areas that we believed relevant for mHealth ecosystem, and we mapped them to a policy development cycle. Then we draw some recommendations for the adoption of these policies by the countries related to mHealth. More details will come later from our colleagues in SPMS. Then besides this deliverable D5.1, there are two more mainstream activities in this work package. One is for the monitoring innovation trends in area like artificial intelligence, big data, interoperability, data sharing, cloud security, and other relevant aspects in mHealth. The other activity is on the open source material for, again, that will support implementation and integration of mobile health. We will engage and build a community of practice that is expected to actively participate in the future to update and maintenance of this open source material. So that's it from my side. Thank you.
Thank you, Simona. Thank you for this wonderful overview of our project. Very very interesting, and I will get into a little bit more detail from what you were saying. This is my role here today, is to give you an overview of how the Hub is contributing to an European mHealth policy framework. So according to the World Health Organization, mHealth, or mobile health, is defined as a medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, and other devices such. The increased presence of mHealth in all aspects of life is undeniable, not only for wellness promotion, but also for health management and public health. Thus, countries and regions would benefit from incorporating mHealth strategies and initiatives into national and regional policies, either as a standalone strategy or part of key health policies as well. The question we all have in our minds is whether health policy ultimately will serve to unite nations and in advancing global health, or keep nations isolated and ultimately making their policy decisions in silos. Such a non-collaborative approach seriously hampers the potential for using mobile health technologies to deliver healthcare across borders and assuring individuals access to affordable, convenient, and quality healthcare. To support these countries, regions, or organizations to implement mHealth strategy, the task force in our project responsible for creating the policy framework of the mHealth Hub is developing a model for a policy framework, which we'll see in a bit. And this preliminary framework was designed to incorporate important learnings from the ongoing desk research, as Simona said, also from interviews conducting to different countries within Europe. The desk research focuses on important examples of the application of policy connected to mHealth, ranging from projects and initiatives to some very specific examples of national strategies from across Europe. So the ongoing interviews have been focusing on detailed sharing of decisions, strategies, and programs, for example, among others. The resulting combination of knowledge acquired is the policy framework that is based on the four main phases of the policy cycle. So we have formulation, which identified issues and problems and addresses these issues and problems leading to formulation of a policy or a strategy. We have adoption or decision making. At this stage, decisions are made at the government level or organizational, which leads to the approval or reshape of the policy obtained in formulation. Then we will have implementation, where the approved policy is implemented with the identification of the policy network, with all the key resources and actors in place, and to execute the approved policy. And finally, we have evaluation and monitoring. The policy is evaluated to verify whether its implementation is aligned with the expected objectives and outcomes defined previously. So in the center of the policy framework is this highlighted main 8 strategic policy areas identified for mHealth that comprehend the shared expertise, experience, and knowledge of the European mHealth Hub. And these are what we call the 8 policy priorities for mHealth. These areas, sorry if you don't mind, Antoine, to just put yourself, if you don't mind. I think, yeah, thank you. So as I was saying, we call this the 8 policy priorities for mHealth. These areas range from general health strategies, governance models, integration mechanisms, reimbursements, ethical and regulatory issues, infrastructure, human-centered design, impact of innovations, and also health emergencies. And having the policy cycle phases and also having the policy areas in mind, we came to the policy framework, which will present relevant and important processes. So as you can see in the dark gray area here, and valuable insights into streams of action and very specific directions to take, represented by what we call their context. So the outer circle, the light gray part. Hopefully, through the ongoing work, it will be possible to build a framework to extract recommendations from reference practices that will support the development of mHealth strategies for policymakers and implementers. And this is the way that we at mHealth Hub are working to contribute to an European mHealth policy framework. So thank you. And I would like to, just before I go, Vanessa put on the chat just something that I forgot, which is we have a challenge for those of you that are watching to go to menti.com. You can see the chats on Menti on GoToMeeting. And we would like to ask you what trends and opportunities can you identify for mHealth policies, and then we can at the end discuss a little bit about what you said to us, and we can have a discussion on it. Okay, so thank you, Vanessa, for reminding. And I would now like to pass the floor to Carme. Carme, thank you so much for being here. It's
Hello. Hello, everyone, and thank you for, first I would like to thank the mHealth Hub to organize this excellent webinar and let us having the opportunity to share with you our experiences related in terms of health policy. Next slide, Before to start, I would like to show you how the healthcare model is in our region in Catalonia. Some key figures about also the number of people and so on, so forth. So the Catalan healthcare model is a multi-provider and is integrated in a single public network. It means that all the healthcare providers have the opportunity to select their information system, and they are autonomous to manage their center. No? So in this scenario, the interoperability framework is a must in order to guarantee the correct integration of the data into the system. And if you talk about some figures about our region, for example, Catalonia has more than 7.5 million people. The life expectancy is around 83 years life, and 18% of the population are over 65 years. So in the recent years, 150,000 people have been identified as a complex chronic patient. So this is something that it's taken into account. And the healthcare system is funded by taxes, and the healthcare has a universal coverage and free access. So the recent pandemic situation has increased the use of the current tools and put the transformation of digital health in the center of all the attention. So imposed by the context and also facilitated by the healthcare system, there has been some change in the access and the provision of the services. So next slide, please. So here's some answers to the challenges we had to overcome at the recent last year. It was enhanced, for example, the emergency call system with more resources and availability. The other thing that was also create several apps for coverage to follow up the pandemic situation, like create contact tracing apps or apps for tracing the symptoms and the emotional situation of the people. Another topic was we have to foster the asynchronous messaging within professional and citizen using, well, to decongest the healthcare system and to foster more services or provide more services, more online services, sorry, for citizens in the healthcare portal, which is called La Meva Salut. Sorry. Next slide, please. Here, in this scenario, the Catalan Department of Health has facilitated the transformation of the healthcare attendance through two big projects. For example, the Latitude, which is related to standardize the non-face-to-face care, and the other one, the mConnecta project, which tries to enable the integration of mobility elements into the healthcare system. And obviously, the other hand, it was fostering the current tools like La Meva Salut and the other one, and others. So next slide, please. Here, yeah, all is related, or all of it is related in its coverage in the current healthcare master plan, which is in the section 10. It's covered all related to digital health. So here we can find, for example, the mConnecta project, the Latitude, and so on and so forth. So, and the next slide, please. Talking more to have a mention about this Latitude project, because I know I don't want to go deep in that project, but it was one of the first actions to regulate in some way how the current non-face-to-face care looks like. This defines a roadmap for the implementation of non-face-to-face care services model in Catalonia. And in this environment, for example, they try to standardize the process, and it's related not only in the mHealth, but also in telemedicine and telehealth. The next slide, please. So here, if you talk about the mHealth, there are three main activities that we are running on. The first is the, well, you can click all three of them. Yes, thank you. The first was the creation of the mHealth plan to support to the integration of the mHealth in the Catalan region. The other is the certification framework for mHealth apps. And the other one, the mConnecta platform, to connect the mobility into the system. Next slide, please. So here in the previous year, before the global plan that we have in Catalonia, the Catalan Department approved the first mHealth plan, which tries to define several strategic lines, such as, for example, classify some initiatives in the regional level, define new interaction models among professionals and citizens, and also standardize this data that we want to collect it into our system, and create a platform, that intermediate platform within the mobility elements through for example, HC3, which is the electronic health record here in Catalonia. So here, as an instrument to make this a reality and make this an operative way, was created or defined the mHealth office, in which office there are some services. For example, we have the Observatory of Experiences, where the professional can ask us or patients which kind of apps there are from several fields, the certification frameworks, internal trend we provided, or mobility standards. Well, in that part, we have a subset of variables who let us to integrate all these elements into the system. And the next slide, for example, here there are an example of the certification framework that we are working on and that we perform. there are 4 steps. I don't want to go deeper on that phase, but here is the first element that it's something that it's needed to integrate digital or mHealth into the system, because we have to guarantee some quality evidence or clinical evidence, sorry, privacy data, and so on and so forth. So in the next slide, please. So talking more into the another activity that we are working on is the mConnecta platform. Actually, this app platform lets to connect these mobility solutions into the healthcare system, but has more functionalities. For example, professional can recommend mobility elements to the patient using the professional's workstation. Also, this data that is integrated can collect all the data provided for those apps that has passed the process, and you can check or tracking in the real time this patient's data. The next slide, please. In this ecosystem, here I want to show you all this ecosystem. It has the interoperability layer. As I said, we have only apps, but also in the near future we will integrate it medical devices. After applying this interoperability layer, there are 2 viewers. In the next slide, it's better, I think. Here we have the administration services for follow up the sets of the platform, for example, and the other viewer, it's for practitioner, where they can recommend the app to the patient, they can follow up the data, and they can, for example, check the ability or the capability of the patient in the terms of using the technology in order to leverage maybe which kind of app they want to recommend to them. And the citizens app viewer, which can see, for example, an app, or it can see only a viewer to the web. But in the most of the cases, the patient have an app. Next step, next slide, sorry. Here, in this scenario, how we do this integration, how we select, for example, the process. There are a methodology on that. The first that is we found important is that the creation of the executive committee of the mConnecta, which is a body where there are several entities in the Department of Health, the healthcare, insurance, and other entities that has the decision-making power to decide the areas and the healthcare process to integrate. Here is the process. For example, they define after defining the process, they define a working group, and this working group define the minimum variables, how the process will be, and define the solution, and deploy the solution and validation integration to mConnecta. And the last slide, the next slide, please. Okay, this is how the state of the integration. For example, here we have done the integration of major ambulatory surgery, and we are working in diabetes. For example, there is in the next few months, it's going to be have a purchase of glucometers, where a public purchase of glucometers, where here we can integrate it. We will integrate it more apps in that sense. Here, another topic to mental health is we are working on bipolar disorder, and also follow up the post-infiltration after in terms of pain. And the last one was that was in the last two weeks was added the home follow up, the home renal hemodialysis. And that's it for my side. And thank you very much for your attention.
Thank you, Carme. Thank you so much. Vanessa, we have a question, right?
Yeah, I was wanting to ask, and thank you for the great presentation, Carmen. I don't know if Esther, we have time. Do you like to make the question or should I read it? If you like, you can speak since we have some time.
Yes.
Okay. I'll go ahead then. So the question from Esther to Carmen, software and mobile applications that fall under the definition of a medical device are regulated by a specific directive, the 93/42 from EC. This means that any software intended by the manufacturer to be used for the purpose of diagnosis, prevention, monitoring, treatment, or alleviation of disease and others require a class 1 or 2A. This includes commercial solutions. I'm listening to myself, sorry. Solutions and AI developments. Is this a class 1 or 2 certification or requirement for mHealth apps to go through the certification process and become accredited to operate within the mConnecta platform?
This okay. Thank you for the question. Actually, when a developer has presented the app to the process, in the first step we ask for the certification, the CA mark, and in that stage, for example, they can present the CA mark, and we take into account when we pass the process. But this is the process has to pass the depending. It's something. It's a requirement. It's a previously requirement to pass the process, but at the moment, it's not mandatory for all the apps. Only for those apps. For example, in the case of diabetes apps, this is something mandatory, but not for other that are, for example, wellness apps or other kind of apps. So in that sense, it's something that we ask for to the developers to present, but obviously in the next regulation that is going to be now, that it's applied now, it's something that will be more restricted.
Okay, great. I think we still have time for one more question, maybe the last one. How many apps has been through the certification process, and if there is a fee?
What is the benefit? Well, okay. Yes, the benefit is that when a developer, for example, has passed the process, they has the opportunity to exchange their information into the system. Otherwise, if they don't pass the process, this won't be possible. And in the other hand, another benefit that they can gain to pass the process is that there are an entity that has revised all the app, and we provide something to improve to the app. At the end, it's something that we want to have more apps, more quality apps into the system and into the market. So it's something that for them. But related to the reimbursement regulation, we are working on that because we know that we have to provide to the developers some kind of benefits in that sense related to reimbursement. But it's on the table now in the government panel.
Okay, we got all time, so I'll back to you, Samuel.
Yes. Okay.
Okay. Thank you so much. Thank you for this discussion.
Thank you.
So next up we have Mariana Meira from SPMS from Portugal, which will share some experiences on mHealth integration in health systems. Mariana, good morning.
Hi, good morning, everyone. Thank you in advance for the opportunity to be here today. So my name is Mariana. I'm here in representation of SPMS, which is a Portuguese governmental entity responsible for the implementation of healthcare information systems. I currently manage the team that develops mobile applications within this ecosystem. And today I will talk a little bit about our experiences on mHealth integrations in health systems, focusing on the patient's view. Yes. In terms of framework, we believe it is important to highlight the path that the Portuguese Health Ministry has been doing in the last decade, and that honestly has allowed us to be here today and to have a set of digital and particularly mobile tools to answer the needs and challenges of mHealth. So generically, this path started in 2007 with the creation of our national health telephone line. At that date, at a basic level, attending mainly pediatrics and pregnancy issues, followed by in 2012 the launch of our Citizens Portal. Then in 2016, our National Telehealth Center was formally created, and in 2017, the National Phone Line has evolved to a specialized contact center, attending multiple clinical and also administrative issues to at a distance of a phone call. In 2017, we have also launched the first version of our national mobile application, My NHS Wallet, which is a mobile app that intends to be a mobile version of the patient's electronic health record, and that I will briefly present further on. In addition to this, and more recently, it is relevant to refer the launch of our teleconsultation platform, which happened just last year, and regarding 2021, the deployment and the proof of concept of the National Health System telemonitoring platform, and the kickoff of an initiative that aims to align and to standardize the digital health services available to our patients that I will also refer to later on this session. If you can please pass, thank you. So along with the strategic and implementation path shown, it is also relevant to analyze the dynamics and paths that the citizens take when seeking healthcare. As we try to illustrate here, these routes are very heterogeneous and have changed a lot over the past decade, showing us that care is nowadays provided within an extended network, as opposed to what happened before, which was mainly between four walls and within a doctor's office. We understand that we need to face this curve as both a challenge and an opportunity, trying to create ways to address digital transformation while redefining some fundamental process. So in this context, we believe that digital transformation must be faced as more than making an electronic tool available, but also as a chance to reinvent, to simplify, and also to promote the interactions of patients with our health system. If you can please, thank you. In terms of mHealth tools itself, and regarding My NHS wallets in particular, the main purpose of this app is to improve the health of Portuguese card by card, and to give our patients access to their health information anywhere, anytime, and within a secure manner. Likewise, our Citizens Portal, this app requires authentication, and therefore it will retrieve specific data according to the end user that is authenticated. It was built according to the citizen's interest, and it gathers the patient's information in its smartphone or tablet, organized in the form of health cards. Each card will then correspond to a typology of health information or service, and the citizen has the autonomy to decide which cards he wants to add and to carry on his wallet. In terms of associated services, it is important to highlight the access to information such as one's immunization records, allergies, prescriptions, exams, and of course, the possibility to perform a teleconsultation with a healthcare professional from our mobile phone. we try to keep it simple and accessible to the citizen, but of course we have faced and still do face a set of challenges that compel us to continuously improve and reinvent our systems. Legacy information systems are always a soft spot, and in our case, considering that the citizens' health data is spread over local and central software within the public and private sector, there is a clear difficulty to collect and to present all this information in a structured way. The digital literacy and its heterogeneity is also a challenge to take into account, and of course some cultural related aspects such as the fondness of proximity and context-based interaction that we still face these days regarding the pursuit of healthcare. In terms of enablers and linking to the challenges identified, the usage of international standards such as NOMED-CT in terms of semantic or HL7 and FHIR consist on a sort of guarantee that the data collected among multiple health systems and interactions present a reliable level of consistency, thus effectively improving the safety and quality of patient care. On the other hand, it is undeniable that the increasing use of mobile devices has created the ideal conditions to the dissemination of principles like health portability, ensuring direct alignment with the adoption of the mobile health concept and the rationale of the mobile first. In terms, if you can, yes, thank you. In terms of our next steps regarding this manner and aligned with the marks for 2021 identified in our initial path, we are realizing that the implementation and usage of mobile health solutions should be sustained and integrated with a set of other complementary channels, such as web systems, by Citizens Portal, through a contact center, and even through presential interactions. In this context, we are now redefining our strategy and systems in order to deliver our patients an omni-channel interaction with the health system, guaranteeing that the system itself can adapt and respond to the needs of each citizen according to its preference or capacity. In general terms, we want to enhance the adoption of mHealth tools and at the same time ensure that each citizen's route is made according to his rhythm, because there is not a single perfect way to fit everybody's necessities. And that closes it in terms of presentation. In case you have further questions after this session, you can always contact me through the email here presented or with resource to the hub partners. Thank you.
Thank you, Mariana. Thank you. This is a wonderful presentation and a wonderful overview of what is happening this time. Vanessa.
Yeah, we have a great question from Erik. Mariana, thank you for the great presentation. Does the electronic health record of a patient is stored in a central place or at the patient wallet?
Okay, yes, that is a very good question. In terms of the mobile application and also the Citizens Portal, what we do or what we aim to do is to ensure that these systems are interfaces to multiple databases. So, for example, we have a national database for prescription. We have a national database for information such as exams. And what we do with the patient's interface is that we aggregate multiple information from all of these sources in order to present it it to the citizen. This to be said, that the information is stored centrally among multiple and segregated databases, and the mobile application, what it does is like an interface or a window to all of that patient's data. There are some information that are stored locally in the mobile application regarding the info contained in the cards, as a way of a contingency plan. So if the systems fail, the mobile application can work in an offline mode. So you have a card with your vaccination, your immunization records, and that data is stored locally on your mobile phone. So if the vaccination system is offline for some reason, you can always access that information if you have already added your card to your wallet in an offline mode. I hope this answers it.
I believe so, and it's very useful if you have, imagine, a medicine work and you don't have your vaccine bulletin with you. No way. I guess we don't have any questions at the moment, so if you still have more questions, oh, there's another question coming. So, how are the data flows secured? How are the data GDPR proof? How does the checks?
Yes, okay, we have in Portugal an entity which is CNPD, Data Protection National Commission, which regulates the implementation and the storage, the communication of our health records. So whenever we have a new system and a new need to store data, we notify this institution, and they regulate and audit our act regarding the data protection issues. There is a set flow for that.
Great.
Great. Yeah, go ahead, Samuel.
Just want to answer Carol, which asks us if the slides will be made available. So this presentation will be recorded and uploaded to the Hub platforms, so you will have access to them. So next up, we have Erik Vertommen. Good morning, Erik.
Good morning.
So the floor is yours.
Okay, my name is Erik Vertommen. I'm program manager in Belgium for what we call the action plan eHealth. And I think it's on the next slide already. If you could show it up. Well, yeah, let's pass this one. Just a short bio. You can read it in the recordings, I guess. So on the next slide, you can see there is an action plan, and in Belgium, mHealth, mobile health, is a part of the action plan. And the action plan, in fact, is a bundling of all projects, governmental projects, so not only the federal but also the regional governments going together to to elaborate more digitalization on eHealth in Belgium. There were two action plans already. There was an action plan called 2013-2018. Even before that, there was already quite some activities on eHealth. In fact, we started, let's say, 2005 with the creation of an eHealth platform. But to bundle it in a combined action plan, it was new in 2013. The input to build up this action plan was done by all stakeholders. Over 300 people were participating in that one. And it resulted in what they call at that point action points. You can call it also projects in different areas of digitalization. And in fact, this action plan was signed off, so supported by all ministers responsible in one way or another on health in Belgium. And you know, in Belgium, it's quite a complex structure. So there are quite some people of quite some ministers responsible for health on their level. And one of those action points was action point 19, was added, in fact, in 2015, but it's called mobile health. And how did we do that one? First of all, we selected, in fact, Dave, because it was before my time. I arrived in 2017. They selected 24 pilot projects. There were 98 project proposals, but the 24 pilot projects were followed and evaluated and financially supported by the government during 12 months. And after that, we evaluated the pros and the cons of these pilots. And so the result of those evaluation was that we started with a permanent organizational structures, which we call the validation pyramid, on mobile health applications. Now, since then, 2018 and a bit later, mobile health is considered as in operational mode, and so it's not in the project modes anymore, meaning in the new action plan started in 2019, you will not find mobile health as such anymore. I must say, and that I didn't mention on this slide, that in the update of the current plan, we added some projects like telemedicine, telediagnosis, telemonitoring, inspired, of course, by what's happened during the COVID crisis. So they are related to mobile health, but not specific for mobile. It's more on telemedicine in the whole, and there also the financial, legal aspects are considered in those projects. But for mobile health, there is a validation parameter, and I will talk about it in the next slide. And it's considered as being in operational modus. So if you could go to the next slide. In fact, we have defined a validation pyramid with 3 levels. And the level 1, and we defined for every level a number of criteria. The definition of this criteria was done in collaboration with the industry. So with in Belgium, we have Agoria and Mentimeter. It's an organization of professional companies working in mobile technology, technical devices. And in fact, we defined together with them all the criteria necessary to go up in these different levels. The lowest level, and it's, well, you can compare it what I heard, what's going on in Catalonia. There is a CE certification as medical device. And so if a company of a mobile application has this criteria matched, it will be referred to in a website where this pyramid is as being M1 compliant, and that mobile application can use this certificate, this M1 level, in its communication, in its publication, in its marketing. That is no issue. In the second level, there are a number of additional criteria, mostly on connection interoperability with the eHealth platform and other systems already available, and it must be validated by administration. So I will come back to the validation because that's an important point to explain also. And then the next level is M3, and M3 is the highest level where you can, as a mobile application, must show that you have social, economical added value, also medical added value, of course. And then you can be in have an agreement to be reimbursed, so that practitioners can prescribe the use of this application. It will be reimbursed to the citizen, to the patient. So this is the highest level you can get with your application. It's then considered as something that's part of the medical environment here in Belgium. Now, a number of things that are very important to mention. Once those criteria were defined together, so with the government and the industry, the whole system was transferred to the industry. So it's now managed by Mentimeter and Agoria, so the organizational structure of the industry, where all the companies that work on this area work together. So the government, in fact, is not homologating or certificating anything of all those, except, of course, the reimbursement. That's a discussion one by one, but the other things are managed, taken care of by the industry. There is I will emphasize, there is no homologation, validation saying, okay, we are, you said you are doing those criteria, we checked it and it's okay. It's just self-declaration by the application itself, and it's in fact a declaration on honor, saying, yeah, I'm doing that one. The idea behind that one is that there will be a peer checking, a social checking, let's say, between the different private organizations, but the government is not intervening on that level. It's just intervening on the criteria, but not on the checking, auditing anything on the declaration by the mobile health builder. So that's an important difference with what I heard from Catalonia. The current situation, as I mentioned in the left lower corner, at the moment, well, it was in January 21 that I had these numbers. They are, as you mentioned, as you can see now, 2 applications that reached level M3. So there are already 2 applications that are reimbursed by health insurance, the federal health insurance in Belgium, and 7 are on level 2. They're saying that they are connecting on safely mode, not only technical but also functional, GDPR compliant, but that's already in M1. But to the e-health extra checkings, like you have to check that there's an informed consent, you have to check if the access matrix is followed, you have to check if the there is a therapeutical relation and all those things. So this is in a nutshell what I would like to talk about on the governance. The main points for me are, there is this pyramid, and the management of the pyramid and the content of the pyramid is completely in the hands of the industry itself. Right. If you have any questions, shoot. I have had 10 minutes, Samuel, so I think I can keep my 10 minutes.
Yes, yes, yes. Very, very well. 9 minutes and some change. Very good. Vanessa.
We do have a question. Yeah. Are you considering apps? Oh, sorry. Are you considering apps that won't be certified as a medical device for the pyramid?
Are you considering apps that would not be certified? No, in fact, if you have just an app and not a wearable, then you can also be on M1. There is no M0 level. This is your question, I would say.
Yeah. Then we have from Bridget as well. How does this decide on access to M3 level and associated reimbursement?
And that, for going to M3, you have to make a face-to-face discussion with the health insurance company institution in Belgium. It's called RISIF or INAMI, depending on what language you speak. But then there have to be discussions with them and you have to prove that there is a medical evidence on the quality of your application or your device, and there is a more in detail, let's say, investigation on what you're saying is correct.
I have another question. How does reimbursement functions in Belgium? Prescription by MD, licenses per patient? No,
there is a prescription per MD. So there will be what we call a number that you can prescribe, and after this number there is this medical device or the medical application, and so based on that one there will be a reimbursement for the patient, or it can be depending on the type of application, it can be organized in another way, so that the patient can buy the application directly at the seller, at the provider, and then there will be a reimbursement directly by received to the patient. But this is case by case, and as you see, there are only 2 applications already in level 3. So we are still learning, let's say, how do we structure that in a more smooth way. Now it's just case by case, which takes quite some time, and that's one of the roadblocks so far, or the difficult things so far, that it takes quite some time to have this discussion finished and to have a reimbursement scheme that's clear. That's a point that we have to work on in the coming months and time.
Okay, I guess we still have time for one more question from Blaine. Is there any key message you will share with other governments facing similar challenge than Belgium? Something to make in a different way, for example, to reinforce, I don't know what the age is?
Well, I think for me, the most important thing is that the role of the government is limited in the operational mode of this pyramid. It's more in setting the play field and setting the criteria together with the industry. And after that, the running of the pyramid and the running of the applications pyramid is done by the industry itself. And I think it's a good thing, because it's gives the responsibility also to the industry. It's not them and us, but it's their responsibility to provide good quality in the applications, and there is an internal checking with the industry. For me, it's the most important point, and the advantage of this is that it's now run by the industry.
Okay, great. I think we are reaching the time. I just would like to remember everyone if they could go to Menti and try to identify trends and opportunities for mHealth policies. There's the link and the code that you can use. Thank you.
Yes, thank you, Vanessa. Thank you, Erik. We can get to there right now. Just to finish up our webinar, we will see this Menti. How is it going? How are the responses from our attendees? Exactly. And now let me just put here the screen of the Mentimeter, and I would like to have a look at this, and to have our speakers to have a look at this, and perhaps comment on this, on what we see here. So we ask you what trends and opportunities in mHealth do you see as the current trends in mHealth related to policy, of course, and what are the opportunities for it. So a lot of what we see here has to do with empowerment. So we have here also something very connected to the patients. And I would like to ask our speakers, how do you see this? In terms of policy, since we are talking about policy, do you see the examples that you shared to help the empowerment and to improve also patient and healthcare relationship? Or do you think that there's another way, if you will? Carmen, you already have your camera connected. So in what way your example shows this?
Yes, actually, if you empower the patient to self-manage their illness, what we see in our activities, for example, is that they increase a lot the commitment to follow up, for example, the the take of medicines, and for example, in the case of the patient that has passed for example, a lot of pain in their body, when they record how many days they have been in a lot of pain. Actually, after passing this period of time, they realize that they don't pass a lot of periods of pain, for example, because the patient that has fibromyalgia or something like that, for example, they thought that they has a period or a crisis every day, but after pass, for example, a month, they realize that that he has only passed, for example, 1, 2, or 3 days a month. This period, this crisis about pain. No, so for this reason, I think it's something that this patient, this kind of patient, feels really feels good because they realize that their illness is not so bad as they thought at the beginning. No, so I think it empower the patient using this mobile technology. It's something that has to go beyond and has to improve and has to go faster. But I think it's better for patients.
Okay, thank you. Mariana, are you?
Yes, I totally agree with Carme regarding the. I believe this is the truth definition of patient-centered care, and the patient's participation on or shared decision making, and their involvement in healthcare is something that can only bring benefits to both parts, both the practitioner and the citizen. Still regarding this matter, of course, we face some difficulties regarding, at least here at our level, regarding the target and the focus of our mobile applications and even telemonitoring systems, because usually the people that most need it are the ones with less digital skills. So this is a challenge that we are still addressing and still facing. But it is undeniable that the interaction and the shared decision making can only benefit the health and the interaction of the patient with the system.
So more on the opportunity side than, unfortunately, on the trend side. Okay. Erik, you have a somewhat different approach in your country in terms of the focus on mHealth versus other technologies, which is also something to consider. How do you see the response from Belgium to this? Does this defocus on mHealth helps or not the citizen in terms of empowerment? As it's
well, it is not that we defocus mHealth. For us, mobile health is more and more natural in the whole treatment of patients. But for me, an important, perhaps more practical detail is that we change the roles of both the patient and the doctor. I mean, if you are having an application at your smartphone where you can record, like I heard, your pain, or you're recovering from a surgery and you record it daily, what's your problem is, and you can be sure that this data is sent to the doctor, and he is checking that, and he will contact you if it's necessary. That changes the way it works, because before that, it was the patient who had an issue. He had pain in the morning, and then he called to his hospital or to his specialist, and he arrived at the secretary of the doctor because he was in a consultation or even doing other surgeries. So, and the secretary said, "Yeah, please call back. And what's your issue?" It was for the too high obstacle for the patient to call regularly and indicating what is going on with him. And now it's changing. It's I record it, and it's up to the specialist to read what I'm recording. So it's changing the focus. It's empowering, let's say, the patient to make sure that to take his own problem, to his own health more in hand, and inform his doctor. And it's the way around. I think that's a good thing.
Okay.
I'm not sure if I'm making myself clear, but I think it's for the patient taking control on what he wants to share with his doctor, and not the other way around.
Yes, and that I will follow up with this yellow here, which is the increase of digital health awareness in health policymakers. So. Does this really happen? Is this a trend, or it's still an opportunity that we have to overcome, or a barrier that we have to overcome to get to our policymakers?
Well, in Belgium, it's already a trend that it's not stoppable. The fact that all the ministers are aware of the need of digitalization, that all the stakeholders are aware, and they are aware and they support it. But it's not always supported in practice. Let's say that takes some time, and to make change in their awareness and in their way of thinking about this one. Well, for me, the idea is that at the end we do not speak anymore of digital health. It's part of health. I use it already several times as an example. I used to work long ago in banking, and there we have e-banking and banking at that time. I'm talking early 90s. And now in health, we have a similar discussion, e-health and health, and it's still shown as two different things. While in banking, nobody speaks from e-banking anymore, because it's just a part of the whole banking environment. And I think e-health should arrive at the same level, that health is consisting on physical contact, but also on digitalization of information exchange. So that's what my ultimate objective is, that nobody speaks anymore of digital health, but from health to good.
That's a very interesting point. Mariana, do you want to add this?
Yes, I agree. It's a quite interesting point, the comparison of health and e-health here in Portugal, and regarding the experience of the bank, we also make analogy to the bank system a lot of times when trying to develop and to implement digital transformation, because it's definitely a reference, and it is true, as you say, we do not talk about bank and e-bank, neither we, the citizens, nor the professionals, but in health there is still a barrier that needs to be overcome. I don't know, some cultural aspects also have an impact on this. Here in Portugal, I believe I see that in terms of the government and strategy, there is already a digital health awareness at a great level, but we still have in the patient side and also in the healthcare professional side some resistance regarding some specific processes. Well, they are done this way they have been doing things this way for a lot of years, and it is hard to change. On that matter, I believe that the government itself has a great role in terms of regulation, legislation, also in terms of incentives, in a way to promote and to disseminate the usage of digital tools to address health systems.
Okay, thank you so much. Carme, how is your experience in Catalonia?
The same as I don't think that I have introduced more topics, but in the case of Catalonia, it's the same as our colleagues has mentioned. Actually, when I did the presentation, I told you about the Latitude project, which is a project that tries to create a roadmap for the implementation of the non-face-to-face care, because in the case of the healthcare process, everything is regulated, everything is clear for everyone. But after, when you apply these new technologies, these new solutions, professionals, for example, are asked about how are their responsibilities, how are worried about this kind of things. So in that case, in this project, try to standardize how will be the relationship between healthcare professional and patient when using, for example, this the e-consulta, which is the messaging with the professional and patient using maybe email or something like that. So in this ecosystem, it's really important make this real as the government level, because define this kind of policies get a high commitment for professionals that has in some ways some doubts about how to use the technology and how will be some kind of responsibilities. No, I think that this is something that it's important to take into account in this in using or this ecosystem. No, for example, in one example of actually what we are working on in our region, I move to a topic, but when you thought about the skills of the professionals when using this technology, it's not something that really easy for them in most of the time. So we are working in a project that try to leverage these digital skills for professional when using mobile application, or maybe this example of the mConnecta platform, because when we did some this pilot stage, we realized that it's a lack of capabilities, or maybe how to say that they get stuck in some phases that when you define the solution, you don't think about it, you know, and it's something that also it's I don't know if maybe in Belgium or in Portugal found this the skills of professionals using this technology. It's a problem, or it's easy for them. I don't know. I send a question.
Well, it's very different in Belgium. I mean, no, it's not different, but there is a very broad range of care providers that are very digital aware and digital knowledgeable. And then on the other end of the spectrum, there are some medicines or doctors, they don't have even have a computer. So they got everything.
Okay.
I have here just yeah. So a lot of these trends that we see here are related with keeping up with the ever-evolving challenges related to digital health. So my question for you, or to put this together, is how can policymakers track these trends and provide strategies to address them? So we have here reimbursement, we have regulatory issues, remote healthcare, integration and adoption, everything. So how can policymakers track this and provide some feedback? Yeah.
Well, if there was an easy answer, it was already done. So it's not so easy. That's one of the main challenges we have as policymakers, to pick up the right trends and to address them in the right way. So it's a constant looking what's going on and trying to identify the trends and talk about it and discuss much with everybody as a stakeholder. So not only the care providers and the care professionals, but also the patients and the citizens. And that's something in Belgium that's growing, the role and the contacts with the patients. We have, for instance, a big questioning recently. We call it the eHealth Monitor, where they interviewed over 10,000 persons, not only care providers, but also a lot of citizens on their knowledge, on the knowledge and awareness of digitalization in eHealth. But apart from the results of this questioning, for me, it indicates the growing importance of the response and what the patients and the citizens really need. Before that, it was more that the care professionals said this is good for the patient, and the patient was in the center of the care around him, of her, but he was not being part of this caring. And now he will be participating in the action plan. We have what we call a cluster of number of projects where we call it the patient as a co-pilot. And that's in fact what we are trying to go to, that the patient is a co-pilot and not a subject of care, but a co-pilot of care. Right.
Very interesting. Mariana, do you want to
yes, I believe it surpasses the actuation of decision makers and has to be sustained with contributes by multiple stakeholders. So it is obviously not an easy task. But as I have previously mentioned, and we have some experiences with this, more in the healthcare professional perspective, the legislation and the regulation are always a point of honor that should be guaranteed by the decision makers and the government. Because sometimes, again, digital transformation has to be more than just making a tool available. We have to include it in the day-to-day, in the work, and also to incentivize its usage. I'm fond to see here this idea incentivizing healthcare professionals to prescribe apps, because this is a thought that we are also making here at the national level with the proof of concept and the pilot of our telemonitoring system, which is to be launched this year. And this is a very good idea. So the practitioner can make a recommendation to use a specific app or a specific program according to the telemonitoring programs existent. So this is a very good tip.
Okay, and Carme, to close this.
I totally agree what they said, obviously. And in the case of Catalonia, the government is trying to respond, to give an answer, to these needs. But I think only to add, it's important, or something to think about, it's how we prioritize, no? Because there are a lot of things to do, and sometimes there are the innovation stay only in a solution that maybe doesn't going to be systemic. But the thing is that we want the solutions solutions that going to be used by everyone and with guarantees. So in this ecosystem, these programs, what we have already said, try to go on that or in that direction, because sometimes it's difficult, no, to a lot of pilot stages and a lot of work there. But the thing is having more solutions that can be systemic and used in a lot of time, no? So prioritize that part is not easy for the government, I think.
Yeah, it's true. I would like to get your attention to what we are sharing on the chat. Birgit would share with us some Belgian e-health monitoring results for you to see. And our time is up. Erik already Erik just left for another meeting. He just sent me on the chat, so sorry for not addressing that. I would really like to go through other issues here, but our time is done. I would like very much to thank you for being here and to participate in this webinar. I hope you enjoyed, and I hope that you have learned something, and your questions were addressed, and your curiosity as well. So in the name of the mHealth project and myself, I would like to thank you all for coming. Thank you, everyone. And you then can access the recording in our mHealth Hub website and other platforms. Thank you so much.
Thank you.
Thank
much.
you.
Bye.
Thanks. Have a nice day.
Bye-bye.
Have a nice day.
You too.
Bye-bye.